A lot of times when we think about creating a work plan for an audit, we focus on those evaluation and management services. But today, let's talk about adding surgical services to that. Hi, Shannon DeConda here with NAMUS. So when you're creating a work plan for your audit, most commonly we hear of organizations focusing on E&M services. Is that what your common MO has been in your organization? I'd like to encourage you to consider adding some of your surgical services to your audit plan. I think a lot of times we don't include surgical services because our providers use like templates with their ops. They tend to do the same surgeries and well, we've audited them before. We feel pretty confident in what they're documenting, but I'd like to challenge you there because sometimes we, as the coder or auditor, fail to know when updates to those templates are made. We also may not always know when modifiers are being added, assisted surgery changes are being employed. So it's always important that all services that a provider is utilizing within their service line, that we are looking at each one of those services as well. So when we're looking at an audit plan, we don't need to ensure that 10 or 20 surgical services are audited. But what if we take and for every surgeon, we maybe keep our 10 E&M services, but we add an additional 5 surgical services. That way we're getting enough to flavor and sample those surgical services. And if something doesn't pass the smell test, if you will, we can always expand that scope. I'm kind of famous for saying in a lot of conversations about work plans, we can't put the genie back in the bottle. So sometimes we just need that sample in order to make sure that there isn't a genie that's ever going to pop out of that bottle. 5 of your surgical notes for your provider's most commonly performed surgeries can do that. Now, of course, that's not the most robust audit plan. If you want to be more robust, why not pull the top 5 CPT code report to show you what their most commonly used surgical services are. This will then drive a better plan. You could pull 2 surgeries per CPT code if maybe this year you would like to focus just on surgical services. Another great way to really create a robust surgical work plan is to actually audit the whole global package. Actually run your report, look for those surgeries, and then start with your surgery, but go backwards one step and look at the decision that led to the need for surgery. Was there any visit in between that maybe was billed, wink, wink, that we need to check the medical necessity and validity of that service on? Then check our op report and then look at that post-operative service work. Were there 24 modifiers that are or are not valid work that was performed? What was the global and what did we actually deliver as global care for those patients? So again, we should maybe start expanding our scopes beyond the E&M. We know we are certainly liable for every claim that goes out of our office, whether it's an E&M or a surgical service. We tend to concentrate on E&Ms because that's the larger bulk of our claims that go out. But remember, those surgeries are high dollar claims. So if you need any help with that, give me a call, leave me a message here, or give me an email. I'm always available and around to discuss your work plan with you. And with that, I think I'll sign off for today and see you next time. Have a great day.